Hello everyone. Today we are going to explore one of the most essential investigation in hematology, the complete blood count or CBC test. Whether you're pursuing a path in clinical medicine, research, or simply aiming to build a strong biomedical foundation, a clear understanding of the CBC test will allow you to interpret some of the clinically informative laboratory data in the modern medicine. A CBC is more than just numbers. It reflects the dynamic biological processes, and when interpreted correctly, it can help us to detect, monitor, and even predict the diseases. In this lesson, I hope you will begin to see the CBC not as a routine blood test, but as a powerful tool so that we can offer insight into the physiology as well as the pathology of our human body. So now let's begin our lesson. After completing our lessons, you should be able to achieve some objectives. First, you can assess the key changes and abnormalities in red cells, white cells, and platelet indices on a complete blood count. Second, you can propose the possible causes for these abnormalities using your logical and evidence-based reasoning. And third, you can recommend further laboratory investigations to confirm and differentiate your diagnostic hypothesis. And finally, you can apply your knowledge of the CBC effectively in the basic clinical scenarios, something you will use again and again, regardless of your medical specialty. Remember, these are not just technical skills, but they are the foundation of your clinical judgment. So let's work toward them together. Okay, now we will begin our lesson with the blood cell evaluation. As you have already known, blood cells are continuously produced in the bone marrow, the central organ of the hematopoiesis. After their development, they enter the peripheral circulation where they carry out their functions. In our clinical practice, we have several tools to evaluate the blood cells. These include the tests on the peripheral blood, such as the complete blood count or peripheral blood smear. We also have more invasive procedures to examine the bone marrow, like the bone marrow aspiration and the bone marrow biopsy. However, in today's lesson, we will not focus on the bone marrow or the central hematopoiesis. Instead, we will concentrate on the changes and abnormalities seen in the blood cells once they reach to the peripheral blood. How we detect them, how we interpret them, and what they might tell us about the underlying conditions. So that is what our objective today. Peripheral blood has three major cell lines: red cell carrying the oxygen, white cell participating in the immune reaction, and the platelets involving in the clotting formation process. So, when we interpret a CBC result, we analyze these three components in turn, starting with the red cells, then white cells, and finally the platelets. When we analyze the peripheral blood, we also focus on three aspects. First, the count. How many cells are there? Then the composition. Are all the major cell types present in the proper proportion? And finally, the morphology. Do the cells look normal in shape and structure? So, the complete blood count, or CBC, is especially useful for assessing cell counts as well as the overall composition. Meanwhile, the peripheral blood smear allows us to examine the cell morphology and, more importantly, help us to detect the abnormal or unusual cells in the circulation, ones that the CBC alone might miss or misclassify. We will be coming back to some of those special cases later. How about the indication of the complete blood count? The CBC test is used across nearly every specialty, not just in the hematology. For example, in internal medicine, it helps us to detect the infection and assess the complication like anemia in patients with chronic kidney disease. In surgery, it's the part of the pre-operative workup, screening for the anemia or bleeding risk due to a thrombocytopenia before planning to the operating room. And in the obstetrics, CBC is used to screen for the anemia during the pregnancy and monitor for pregnancy-related complications, such as the preeclampsia or postpartum hemorrhage. Beyond clinical specialties, CBC is also a standard part of the routine health checkups. It offers a simple, cost-effective way to catch early signs of the systemic problems, sometimes even before the symptoms appear. It's also essential in tracking patient progress, both in outpatient settings like follow-up for the chronic kidney disease or other chronic diseases, and inpatient records, especially for the monitoring the infection, cytopenia, or treatment response. It is fast, accessible, and informative. So that's why the CBC remains a cornerstone in daily medical practice. The CBC test can perform in two ways, manual or automated. In the past, cell counts were done manually using a microscope and a counting chamber. It was time-consuming and labor-intensive. For a large hospital or high workloads, manual counting simply isn't practical. Fortunately, with the advancements of the technology, automated hematology analyzers have become the standard. They provide faster results, greater consistency, and are now widely used in almost all clinical settings. Most automated hematology analyzers today examine the three main blood cell lines, red cells, white cells, and platelets. For the red cells, we measure the values like the red blood count, RBC, hematocrit, HCT, or hemoglobin concentration, HGB, and other red cell indices, MCV, MCH, MCHC, and RDW. For the platelets, the key value to focus on in these courses is the BLT, or the platelet count. Other indices like MPV or BDW are available, but not our priority today. And for the white cells, most modern analyzers provide 11 parameters, identifying the 5 distinct subtypes as well as the white blood count. The subtypes are the neutrophils, eosinophils, basophils, lymphocytes, and monocytes. Each subtype is reported both as the absolute count and the percentage of the cells. That's the system we will focus on in this course. However, you will see older analyzers in some hospitals when you are in training in the country city. These typically report only 7 white cell parameters, not like the 11 parameters as we discussed before. That is because of using broader categories of the granulocyte for the gran, which mainly correspond to the neutrophils. The lymphocyte is appropriated with the lymph, and the mid for the remaining mixed population, including monocytes, eosinophils, as well as the basophils, and sometimes atypical cells. So don't be surprised if the lab printout looks different during your hospital training. And another important point, most hematology analyzers today are designed to recognize and classify the normal peripheral blood cells, red cell, white cells, and platelets based on the size, granularity, and other physical properties. However, when abnormal cells appear in the peripheral blood, like the blast cells, or the nucleated red blood cells, or other immature forms that typically belong in the bone marrow, and the machine may struggle to identify them correctly. These abnormal cells can be misclassified, leading to inaccurate counts and misleading flags in the results. That's why we often need to review the peripheral blood smear, especially when the analyzer gives the unexpected results, to look for the signs of the leukemia, the severe anemia, or other marrow-related pathology. So, while automation improves speed and standardization, it still requires critical thinking and manual confirmation when the abnormalities are suspected. When you are interpreting a lab result, at what point do you say this value is abnormal? Most lab reports will automatically highlight or underline the values that fall outside the reference range. But here is the key. That doesn't always mean it's clinically abnormal. Let me show you an example. These are two CBC results from two hospitals here in the Cần Thơ city. On the left side, it is from the Cần Thơ Central General Hospital. And on the right side, it is from our hospital at the CTUMP. Now, take a look at the MCV value. And remember, our patient MCV is 98 femtoliter. It will be flagged as abnormal at the central hospital, but completely normal at our CTUMP hospital. So, who is right and who is wrong? Actually, neither. Each machine or lab uses its own reference range based on the calibration, population data, or analyzer settings. But in this course, we don't rely on the machine-generated reference range. We will use the standard diagnostic criteria, which is evidence-based cutoffs that are consistent no matter where the test is performed. And I want you to practice using these criteria, not the automated reference intervals printed on the report. That is very important, and I would like you to remember. Okay, now, that wraps up on the key concepts about the complete blood count, its clinical indications, and a brief introduction to automated hematology analyzers. In the next video, we will dive into the first group of indices, the red blood cells parameters. So, see you in the next lesson. Thank you for watching our video.